My name is Milo Sewards. I'm one of the sports medicine surgeons at Temple and one of the team physicians for Temple. Most common knee injury I see is probably a tear of the anterior cruciate ligament. There's a lot of sports that put the knee at risk where there's a buckling injury and it tears the anterior cruciate. And especially in adolescent athletes, high school athletes, college athletes, when you tear the ligament, initially you lose motion because of the injury, but ultimately it's that you lose stability. The knee becomes unstable. Athletes lose their confidence in their knee. For most athletes, or for people who want to get back to relatively high-level athletic participation, we typically would recommend a reconstruction. And so we'll get them into physical therapy before the reconstruction to try to restore range of motion to their knee and get them ready for the surgery. And then once we go on to do the reconstruction, there's various techniques that can be used, various different materials or grafts that could be used to reconstruct the ACL. And I like to offer all the different possibilities with regard to which graft might be used or which technique might be used to have a good discussion about what they can expect from their surgery and what they can expect from their recovery. In terms of what we recommend for the reconstruction, some of it is the age and activity level of the patient. As an example is that for younger patients, we tend to recommend that we use their own tissue for the reconstruction, whereas for older patients who might not have the same athletic demands, we can use donated tissue as the graft. I like to offer my patients the ability to decide for themselves. I give them all the evidence and give them all their options so that it's less of a dictatorship where I'm telling them what they're getting and more of a discussion with the patient regarding what their values are, what their interests are, what's important to them with regard to postoperative pain, return to function, timing of return to function, and timing of return to sport ultimately. My typical answer for when I'm asked, how am I going to ever get back? How am I going to play? Am I going to play the same way? Is that my goal is to get them back to 100%. Get them back to where they're fully confident in their knee and they get back to the same level of activity. I've realized that a good amount of my job is not just to be the surgeon and not just to do the technical aspects of my job, but to also help coach a patient into being where they want to be. It's a big part of what the physical therapist does as well. I'm blessed with the opportunity to work with some world-class physical therapists, and I recognize their ability to communicate with the athletes at their level, and whether it's as a peer type of communication or whether they act as a coach, they help me in phenomenal ways to get athletes back to where they want. So Temple Sports Medicine has a tremendous reputation and history in that it was one of the first university-based sports medicine practices that offered arthroscopic surgery and all along has been pushing more arthroscopic techniques and more advanced techniques in ligament reconstruction, in cartilage preservation, and in meniscus surgery as an example. One thing that I think we offer is not just the history of having done that, but that we continue to offer the most innovative arthroscopic techniques to get athletes back on the field.